Hello and welcome to the ASCO Guidelines Podcast, one of ASCO's podcasts delivering timely information to keep you up to date on the latest changes, challenges, and advances in oncology. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today I'm interviewing Dr. Larissa Nekhlyudov from Brigham and Women's Hospital and Harvard Medical School, and Dr. Raymond Chan from Flinders University, authors on Survivorship Care for People Affected by Advanced or Metastatic Cancer, Multinational Association for Supportive Care in Cancer, American Society of Clinical Oncology, Standards and Practice Recommendations. Thank you for being here, Dr. Nekhlyudov and Dr. Chan.
Thank you for having us.
Great to be here. Then before we discuss these standards, I'd like to note that ASCO takes great care in the development of its guidance products and ensuring that the ASCO conflict of interest policy is followed for each panel. The disclosures of potential conflicts of interest for the expert panel, including the guests on this episode today, are available online with the publication of the standards in the JCO Oncology practice, which is linked in the show notes. So then to dive into the content of these standards and recommendations, first, Dr. Chan, could you provide both an overview of the scope and purpose of these joint MASCC-ASCO standards and practice recommendations?
Thank you, Brittany. First of all, as outlined and introduced by yourself, I would like to acknowledge that this is a great collaboration between the Multinational Association for Supportive Care in Cancer and ASCO. And if you may indulge me for a minute, I would like to give you a little bit of background of how this all started. It was in 2019 when I came across this article written by Ms. Terry Langbaum and Dr. Thomas Smith, who wrote a piece in the New England Journal of Medicine outlining the insufficient work and research done to advance care for people with incurable long-term metastatic cancer survivorship. And both Terry and Tom were living with metastatic cancer, and with their lived experience, it provided a new level of meaning to our work. And subsequently, in honor of Terry Langbaum, who is a renowned, esteemed hospital administrator who works in cancer care, Dr. Thomas Smith and myself created this Terry Langbaum Cancer Survivorship Fellowship and appointed Dr. Nicholas Hart to complete this work. And within this work, we aim to develop international standards and practice recommendations to guide care for people living with treatable but incurable metastatic and advanced cancer. In this work, we conducted an extensive systematic review involving 81 studies, 17 guidelines and framework documents, gathering the wisdom and consensus from 77 experts from 33 countries around the globe. And together, we reached consensus on 45 recommendations that we hope will be helpful for the clinical care community in improving care and experiences and outcomes for people living with metastatic cancer.
Excellent. Thank you for providing this essential background information and describing the impetus for this project. Then, as you discussed, Dr. Chan, these standards and recommendations have over 45 recommendations within them. So I'd like to review each of those key points from each section. This document provides these standards and practice recommendations across 7 domains. So to start with that first domain, Dr. Chan, what are the key points you'd like to highlight regarding person-centered care?
Sure, Brittany. Now, without repeating what is in the document, because I hope that this podcast can lead you to that document and for you to read it in details, it is really around a comprehensive set of principles that the experts felt were important to ensure that patients themselves participate in the care as much as possible. It is around respecting their agency and making sure that their clinical and psychosocial care needs associated with their metastatic cancer diagnosis are considered and addressed.
Absolutely. Thank you for providing those key points regarding person-centered care. So moving into that next section, coordinated and integrative care, what points would you like to highlight there?
So thank you, Brittany, for the question. The standards and recommendations within the section is really around articulating the coordination, navigation, and the multidisciplinary care team approach requirements for this population. And in particular, for people living with metastatic or advanced cancer, it is not a given that they will be able to access survivorship care services or palliative care services. And a lot of time we know that care access is around the resource setting. And a lot of the time palliative care services not necessarily able to cover people living with a relatively longer prognosis, such as this population, longer-term metastatic and advanced cancer population. And another point is around the transition and the shared care arrangement between the oncology teams, survivorship care clinicians where available, and the palliative care team. So once again, these recommendations really articulate the importance of a well-coordinated, integrated approach for these patients.
Absolutely. Those points that you just highlighted are important for care for the whole patient. So then next, Dr. Nekhlyudov, I'd like to turn to you for the next couple of sections, but could you review what the highlights are for the next section, evidence-based and comprehensive care?
Yes, thank you, Brittany. So this standard emphasizes that people affected by advanced or metastatic cancer receive the most up-to-date, evidence-based, comprehensive, multidisciplinary, and interprofessional survivorship care, and receive it in programs that continuously evolve their approach as guided by evidence. So as such, it is important that these survivorship programs are informed by the ongoing professional development, including educational programs for healthcare professionals that also includes active contribution by those affected by advanced or metastatic cancer. The other piece is that people affected by advanced and metastatic cancer should receive comprehensive care that encourages and supports informed decision-making in order to promote health, manage disease, and reduce stress.
Definitely, those are very important points regarding care of the patient. So then moving into the fourth domain, Dr. Nekhlyudov, what are the key points for evaluated and communicated care?
Well, so, famous line is what can be measured can't be improved. And so it's important that clinicians routinely and systematically evaluate and monitor supportive care needs and provide appropriate referrals to relevant survivorship care services and healthcare professionals. And in order to do that, we need to establish multidirectional communication system that takes into account communication with patients and communication across healthcare professionals involved in their care. Effective communication, of course, needs to be timely, it needs to be clear, effective, respectful, and appropriate. We all know that communication is challenging across cancer care, but may be particularly so in this specific patient population. So, for example, in communicating with patients, cancer care clinicians may be comfortable communicating with those with early stage cancers or patients with early stage cancers, and may also have had training to communicate with those patients nearing the end of life. But as we already mentioned, those affected by advanced or metastatic cancer may have different needs. And as such, it is important that there is additional training for clinicians to address survivorship care needs among these individuals and their caregivers. And then in addition to patient-clinician communication, to enable timely communication and collaboration between multiple healthcare providers who may be involved in caring for these patients, enhanced and secure communication strategies are needed. And, as with everything else, it's important that healthcare settings engage in service evaluations and quality improvement activities to continue to examine what works, what does not, and make changes that are needed.
It is important that these patients with metastatic or advanced cancer, their unique needs are met by providing care and appropriate communication to them. So then into the next section, Dr. Nekhlyudov, I believe Dr. Chan mentioned this briefly already in talking about being able to access care as part of integrative care, but what is recommended regarding accessible and equitable care?
Right, absolutely. As with any healthcare or cancer care, this standard emphasizes that cancer survivorship care for all people affected by advanced or metastatic cancer is not only comprehensive, but also accessible. So affordable, acceptable, available, and appropriate and equitable. And the key is that it does not vary based on someone's personal, cultural, or religious factors. It is important that health workforce diversity and cultural awareness training with the development and provision of culturally and linguistically appropriate resources that these can help healthcare professionals better understand and cater to the unique needs of the cancer survivors and the caregiver populations. We need to develop metrics to assess the evaluation and improvement and make sure that supportive care options are innovative, inclusive, and targeted towards eliminated disparities. Some of the work that Dr. Chan has otherwise led is looking at the provision of telehealth and virtual care for cancer survivors. So particularly for this patient population, it is important to examine the potential benefits of virtual health care so that these patients, who may have a lot of different needs, physical challenges, mental health challenges, caregivers, that we don't unnecessarily bring them to the healthcare setting and can potentially provide them the care that they need. And the last thing that I just wanted to point out with respect to this is that people affected by advanced or metastatic cancer may face additional challenges, particularly returning to work in some capacity, and should be supported by advocacy groups or consumer groups, as they're often called internationally, that advocate for accessible and equitable care, and then work with specific personnel to access employment, financial, and legal assistance that they may need.
Those are important for providing both inclusive and individualized care to every patient who a clinician may see. So then following those points, what is recommended and what are the key points you'd like to highlight regarding sustainable and resourced care?
Yes, thanks, Brittany. So this is a really important point, and not to take away from any of the other standards, but in order for us to provide ongoing quality, high quality cancer survivorship care for people affected by advanced and metastatic cancer, we need to have a sustainable and adequately resourced approach to do so. So these standards acknowledge that not all countries or healthcare systems have access to sufficient resources. As such, supportive care may utilize a stepped care or resource stratified approach that offers the least resource intensive care that aligns with the needs of the patient, but then also takes into account resources that are available. But really, it's the care that we provide should not stop there. Survivorship care interventions and models of care should be cost effective, yet clinically relevant and meaningful, and need to have the adequate financial investment by the healthcare systems. So healthcare settings providing survivorship care for those affected by advanced or metastatic cancer have to be properly resourced in order to provide high quality ongoing care. And this includes intentional planning for support services, and where healthcare settings provide these programs with adequate level of human resources, equipment, facilities, and leadership who value, support, facilitate, and appropriately invest in such care. And as we mentioned before, it's always important to continue to evaluate what is being provided, what is being offered, sort of what are the return on investment metrics in order to continue to evolve the programs to serve the needs of the population.
Understood. I appreciate you providing highlights across these past couple of domains. So then to turn to the last domain, Dr. Chan, what is recommended regarding research and data-driven care?
Sure. The panel actively advocated for cancer registries to enable population-wide surveillance of incidence and prevalence of people with advanced or metastatic cancer. Knowing the number of people with advanced or metastatic cancer is extremely important for care planning. We also advocated for active involvement of people affected by advanced or metastatic cancer to participate in the co-design of research so that we can make sure that our research better meet the needs of end users and enhance the rigor, relevance, reach, and impact of survivorship research. The last point I would like to highlight is that a number of survivorship trials out there only limit the population or the focus of the trial being on early stage disease, people treated with curative intent, And within these standards and principles, we advocated for research trials to explicitly include people affected by advanced or metastatic cancer in the clinical trials, and trying to address all sort of barriers that impede people from enrolling or participating at all levels.
Thank you both for reviewing these key points, standards, and practice recommendations across these 7 domains. So these standards and recommendations cut really across all aspects of care for people impacted by advanced and metastatic cancer. So Dr. Nekhlyudov, in your view, what is the importance of these standards and how will they impact clinicians?
Thank you for that question, Brittany. The MASCC-ASCO standards were developed, as we already mentioned, to promote the provision of high quality, evidence-based survivorship care for people with advanced or metastatic cancer, emphasizing the need for care that is person-centered, coordinated and integrated, evidence-based and comprehensive, evaluated and communicated, accessible and equitable, sustainable and resourced, as well as research and data-driven. So for clinicians, these standards and practice recommendations provide a critical resource in order to facilitate tailored and effective care for people living with advanced or metastatic cancer across disciplines and settings. So as we know, and much of it due to the efforts of ASCO, cancer care is always changing, resulting in changing prognosis. As such, people diagnosed with cancer in the past that had poor prognosis are now living and are living longer. And so diagnoses that fall into this category, the specific category of patients that we're discussing here today, will continue to evolve. And likewise, advanced cancer is less clearly defined for other cancers, such as hematologic or CNS malignancies. But these survivors may face similar issues and challenges. So overall, applying these standards will help provide survivorship care to these patients. And the important piece is that what we hope to achieve with these standards is that when we consider survivorship care, we're not only applying it to those who have early stage disease. We're not applying it only to those whose disease has been cured, quote unquote. We're not applying it to those who have been deemed disease-free or those who have completed treatment. We really need to make sure that clinicians understand the challenges experienced by often disregarded or forgotten population of cancer survivors, and yet acknowledge the ever-changing landscape of cancer survivors and appropriately apply these survivorship standards for people affected by advanced or metastatic cancer. And I think, as Ray would probably say as well, we should focus on including rather than excluding people with cancer, all cancers, from survivorship services and programs.
Definitely. This is an important population with often unrecognized or unmet needs. And the goal of these standards, as you mentioned, is to provide a better quality of survivorship care for patients with both advanced and metastatic cancer. So that leads nicely into my final question for you, Dr. Chan. But in your view, how do these standards and recommendations impact people affected by advanced or metastatic cancer?
As we continue to promulgate these standards and recommendations, I believe that the patients will benefit from these standards in 3 ways. First is as clinicians, researchers, and service planners continue to improve care as per outlined in the standards, patients are going to indirectly benefit from it. And it is meant to lead to better care, better experiences, and better outcomes. Secondly, it is around the expectation of care. Many of us here would know that if we don't expect that care, it is unlikely that we would go and try to access it. And so it is extremely important that patients know what to expect. So now that I have been diagnosed with advanced or metastatic cancer, what does good care look like? So in the past, there are a number of palliative care standards whereby when people are thinking through, do I need palliative care? What does good palliative care look like? there are a set of standards. And now these standards would enable patients to develop that expectation around what good care looks like. Thirdly, it's around the patients, the family units, and their navigators or the care networks to advocate for themselves, to advocate for the patients, to be able to access that care from the care teams. So we hope that as we continue to promulgate these standards, that benefit will be translated in real world for people affected by advanced or metastatic cancer.
Excellent. We definitely hope that this improves care for all patients impacted by advanced and metastatic cancer. So I want to thank you both so much for this important work to develop these recommendations and standards. And thank you for taking the time to speak with me today, Dr. Nekhlyudov and Dr. Chan.
Thank you. Great to be here.
Thank you.
And thank you to all of our listeners for tuning in to the ASCO Guidelines podcast. To read the full standards and practice recommendations, go to www.asco.org/standards. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.